When a doctor says that you have high blood pressure, diabetes, or just need to lose a little weight, it's hard to know where to look for the right information and support. Well, Dawn Owens is CEO of Optum Health, a company that provides personalized health management and support. Welcome, Dawn.
Thank you. It's great to be here.
Yeah. Well, so what does Optum Health do?
Well, really, we help about 60 million people as they navigate the healthcare system. I don't know about you, but it's pretty complex. It's hard to do. And we look at it from a very holistic perspective. So helping you from your mind, your body, and your wallet, think about healthcare and take charge of your health.
That's great, because I think of health as like a total health picture. You know, it's a little bit of everything. And I know that you helped one guy just do a 180, a complete change, and we are going to watch that right now.
I got the call from a health coach from Optum Health, and I didn't know we had this option on our health insurance, but he was a very pleasant gentleman, asked me if we had any concerns, and I told him that we were mostly concerned about Marvin's diabetes and trying to get more information that we could really use to figure out what was going on.
My diabetes went on for like about a year or so, and we didn't do a whole lot about it. But then I started having low sugar levels. It's that real low feeling when you just can't physically move, literally.
I had some questions that were very immediate. He connected me right then to the nurse. The nurse was also concerned that perhaps the medication dosage was too high and it was lowering his blood sugar too much, which at that point in time, we weren't using a meter. We didn't know how to measure that to find out what was going on.
So we got a meter to measure the glucose now.
And the nurse also encouraged us to see an endocrinologist. The nurse gave me some really good information, telling us some next steps to take in order to best deal with Marvin's diabetes. And then she also put us in contact with a diabetes coach to talk through what next steps we need to take.
So this goes into my lunch bucket. We know now a lot about how to eat and what to eat and when to eat. I think it's in control in that we can manage it. Feel a whole lot better with the information and with an approach to go on this lifelong journey now of managing the diabetes.
Is this a typical story for Optum Health?
It actually really is a typical story. In fact, last year we helped 700,000 people like Marvin.
So what do? You do lifestyle changes?
We really focus on education and action. How do we educate them about the disease or their potential to develop that disease? And how do they take control and take action to prevent the onset of some of the complications or to prevent the disease overall from coming into their situation?
Right, and you know, it was interesting because he said, you know, all of a sudden he was feeling like lightheaded and everything else, and he was feeling sick again. And a lot of it had to do with the fact that as he was getting healthier, his insulin had to come down. So do you have somebody managing that as well?
Yeah, absolutely. So we have health coaches, we have nurses, and we tie very closely to individuals' physicians because they are a really important part of the overall healthcare equation. You need to work with physicians who actually know about your condition, know about you overall and what's going on with your health, so that all the pieces and parts can be working together and be calibrated as you actually are improving your health.
And we are seeing so much diabetes. I mean, even our little children, 5 years old children, are getting type 2 diabetes because of the way we eat in this country. You know, so we have to really change that. So it's great if you can, you know, do you work with kids as well?
We do. We work with adults and kids because generally we're hired by employers or health plans or even states and other government programs to help them manage the overall health care costs and quality of care for the patients that they're responsible for.
And the money that you save the country,
goodness, yes.
You know, and the individual, of course.
Well, we save money, but frankly, we save lives and we save individuals' well-being and lifestyles, the ability to spend time with your family, the ability to travel to that wedding.
Yeah, the quality of life is better.
Oh,
you know?
It's awesome.
So anyway, well, thank you so much for joining us. A lot of great information.
It's great to be here. Thank you so much, Mary Lou.